Hey there, Ariana and family. This is Dr. Matt Joosse. Just wanted to give you guys a quick response. I hope that you're having a great summer and getting ready for the start of a school year. So let me walk you through what I'm seeing. Here we look at the lower front teeth, and you can see that in the front there's 4 adult front teeth. 1, 2, 3, 4. In the back, way back here, it's kind of getting dark, but over here are 2 adult teeth. On the left side, we have 1, 2, 3 baby teeth in between the adult teeth in the front and the adult teeth in the back. This is what you want. Over on the right side, we only have 2 baby teeth here because the third one, the one in the front, was lost early. It was probably pushed out when this incisor came in. And now that that baby tooth is gone, these incisors are moving that direction and into that space, which is a problem because we really need to have that space available for the adult canine tooth to come in the future. So we have actually a crowded situation in the lower. It just doesn't look crowded, but that's because one of the baby teeth has been lost early. As we look to the upper teeth, we can see something similar. So in the front, we have 3 permanent teeth, 1, 2, 3, and in the back, we have 1, 2 permanent teeth. The other one in the front is getting ready to come through, and it's probably going to come through looking a lot like this one over here. In between the adult teeth in the front and in the back, we have 3 baby teeth on each side, 1, 2, 3, 1, 2, 3, which is exactly what you want. The problem with where this tooth is coming in is that it's coming in right on top of some of the lower front teeth. So right here, and this will start hitting very soon. And you don't want that arrangement because, first of all, it's uncomfortable for front teeth to hit. Second of all, it causes the front teeth to be worn down prematurely. And so you really don't want this arrangement. Not to mention it doesn't really look all that good either, but I think that we'll talk about how we fix that in just a second, but that is definitely a problem. So right now our problem list is that we have lower crowding and we've got this upper front tooth coming in a way that it really shouldn't because it's hitting right on top of the lower front teeth. And then there's another bite issue that I see. Now, I would need to examine you in person to really be sure about this, but it looks like that when we get to the back of the mouth, that some of the adult teeth on top are to the inside of the lower front or the lower back teeth. And all upper teeth should always be to the outside of the lower front, the lower teeth. So upper teeth should always be to the outside of lower teeth. That allows your bite to function correctly. When they don't sit in that relationship and upper teeth are to the inside of lower teeth, we call that a cross bite. Cross bites, and I'm guessing this is what's happening in Ariana's mouth, although it's a little hard to tell from the pictures, actually can cause the jaw to grow in some abnormal ways. And it's a little hard to demonstrate here, but essentially she shifts her jaw to try to make one side fit correctly and then the other side doesn't fit correctly. But the root of the problem is that it's a small upper jaw, and I can see that by looking at this picture of the upper arch. The arch is very narrow, the teeth are flared outwards trying to touch the lower teeth, and so I believe that this is a really good example of where early treatment can be very, very beneficial. And typically our treatment here would look like probably a maxillary expander, something that makes the upper jaw bigger, because at young ages, 8, 9, 10, we can influence the size of the jaw. We can actually make the upper jaw bigger. That's a very easy process. My son just had the same thing in his mouth. And then as we make that upper jaw bigger, we gain space so that we can get the front teeth straight and looking really nice. And so at the end of it, we've got a nice healthy bite with the teeth in the proper relationships in the back. We've got a nice healthy bite in the front of the mouth with that one tooth not hitting what we call edge to edge right on top of the lower front teeth. And we'll actually have the teeth nice and lined up and looking really good so that she has a nice smile as well. The nice smile part is kind of just a little icing on the cake, but you get the idea of we're really in there to make the bite healthy and make sure that the bite relationships are good so that her jaw growth can happen normally. So that's kind of what I'm seeing. That's a little quick and dirty consultation. I could certainly get more information by having an x-ray, one of the panoramic x-rays that shows all the teeth in the mouth and everything that's happening underneath the gums. Certainly would love to see you guys in person. We can definitively talk about what's happening with that bite in the back and if we need that expander. And we can talk a little bit more in depth about what treatment would look like. So if you would like to set up a consultation with us, please just let us know. I can have one of my awesome team members reach out to you guys or you can call the office and set up that consultation. And of course, if you have any questions about what you've heard from me so far, just let me know. All right, have a good day. Take care. Bye.